Cancer is one of the most frightening health challenges, impacting millions globally every year. Among the many types, colon cancer stands out as both common and deadly. The World Health Organization reports nearly 10 million cancer-related deaths in 2020 alone, with over 100,000 new colon cancer cases diagnosed annually in the United States. Colon cancer originates in the colon or rectum, often beginning as small, harmless polyps that can turn cancerous over time. The good news: early detection can make a world of difference. Colon cancer is highly treatable in its early stages, and staying alert to warning signs while keeping up with regular screenings can dramatically lower the risk of a late-stage diagnosis. Knowledge and action are your best defenses. Number 8. Rectal bleeding. One of the earliest and most concerning signs of colon cancer is rectal bleeding. Bright red or dark maroon blood in your stool can signal abnormalities in your digestive tract. Bright red blood often indicates issues in the lower digestive tract, such as the rectum, while dark maroon blood suggests problems higher up in the colon. Hemorrhoids, anal fissures, or minor injuries can also cause rectal bleeding, but the bleeding associated with colon cancer tends to be more severe and persistent. Studies show that around 90% of patients with rectal cancer experience bleeding at some stage. Ignoring intermittent rectal bleeding is a common mistake. Even if the bleeding stops temporarily, it's crucial to consult a healthcare professional. Regularly inspecting your stool may seem unpleasant, but it can be a vital step in detecting colon cancer early, potentially saving your life. Number 7. Narrow stool. A noticeable change in the width or shape of your stool could indicate colon cancer. Tumors growing in the colon may partially block the passage, causing stools to appear thinner or pencil-shaped. Keeping track of the size and consistency of your stool over time is essential for identifying unusual changes. Frequent occurrences of narrow stools, especially when accompanied by other symptoms such as bloating or constipation, are strong indicators of a potential problem. According to the National Cancer Institute, significant changes in bowel habits, including stool shape, should prompt immediate medical attention. While temporary changes in stool consistency can result from dietary fluctuations or stress, persistent changes warrant thorough evaluation by a doctor, including possible colonoscopy or imaging tests to rule out cancer. Number 6. Persistent constipation. While constipation is a common issue often linked to dietary or lifestyle habits, persistent or chronic constipation may signal a more serious underlying condition, such as colon cancer. A tumor obstructing the colon can prevent normal bowel movements, causing a buildup of waste in the digestive tract. Chronic constipation may also lead to additional complications, including hemorrhoids, anal fissures, or even bowel perforation in severe cases. According to the American Gastroenterological Association, long-term constipation that does not improve with dietary changes, hydration, or over-the-counter laxatives requires medical evaluation. Recognizing the difference between occasional constipation and a more persistent issue can be life-saving, as it allows for early diagnosis and treatment before the cancer progresses. Number 5. Ineffective bowel movements, tenesmus. Tenesmus, the sensation of incomplete bowel evacuation, is another significant warning sign of colon cancer. This condition occurs when tumors or other abnormalities partially obstruct the rectum or colon, making it difficult to fully empty the bowels. Individuals may feel a constant urge to defecate but find little or no stool is passed. Tenesmus is often accompanied by other symptoms, such as abdominal cramping, bloating, or rectal bleeding, making it a key indicator of possible colorectal issues. According to research published in the Journal of Gastroenterology, tenesmus can also result from conditions such as inflammatory bowel disease or irritable bowel syndrome, but its persistence necessitates further investigation. Medical imaging and colonoscopy can help identify the root cause and facilitate timely treatment. Number 4. Anemia. Unexplained anemia can often indicate hidden blood loss caused by colon cancer. Tumors in the colon or rectum can bleed slowly, leading to a gradual depletion of red blood cells. This type of blood loss is not always visible in the stool, but can cause symptoms such as extreme fatigue, weakness, dizziness, and shortness of breath. Iron deficiency anemia is particularly common among colon cancer patients, as the body struggles to replace the lost blood. Routine blood tests can detect anemia and prompt further investigation into its cause. According to the Centers for Disease Control and Prevention, anyone experiencing persistent anemia should undergo screening for potential sources of bleeding, including colonoscopy, to rule out malignancies in the gastrointestinal tract. Number 3. Abdominal pain and cramping. Persistent abdominal pain, cramping, or bloating is a common symptom of colon cancer, often caused by tumors creating blockages or inflammation in the digestive tract. This discomfort can range from mild and intermittent to severe and debilitating. Tumors may obstruct the normal flow of waste, leading to bloating and gas buildup. Over time, these symptoms can worsen, becoming increasingly disruptive to daily life. According to the National Comprehensive Cancer Network, individuals experiencing persistent or worsening abdominal pain, particularly if it is localized, should consult a physician immediately. Early diagnosis and intervention can prevent the tumor from spreading and improve treatment outcomes significantly. Number 2. Unexpected weight loss. Sudden, unexplained weight loss is a hallmark symptom of many cancers, including colon cancer. Tumors can disrupt the body's ability to absorb nutrients properly, leading to rapid weight loss despite normal or increased food intake. Additionally, cancer cells may release substances that alter metabolism, causing the body to burn calories at an accelerated rate. According to the American Cancer Society, unexplained weight loss of 10 pounds or more in a short period should be considered a red flag. Keeping track of your weight and consulting a healthcare provider promptly if significant changes occur is crucial for early detection and diagnosis. Unexplained weight loss, especially if it exceeds 5% of your body weight within 6 months, is a serious red flag. For instance, if someone weighs 150 pounds and loses more than 7 to 8 pounds without trying, they should consult a doctor immediately. While there are other potential causes, such as thyroid disorders, diabetes, or gastrointestinal diseases, the possibility of colon cancer or another malignancy must be ruled out. Number 1. Nausea and vomiting. Nausea and vomiting are common responses to blockages or obstructions in the digestive system caused by colon cancer. As tumors grow, they can restrict the movement of food and waste, leading to discomfort, nausea, and sometimes severe vomiting. Chronic nausea, particularly when combined with other gastrointestinal symptoms, can significantly impact quality of life and may be an early indicator of a larger issue. Studies indicate that symptoms such as vomiting, when persistent, are often linked to advanced stages of colon cancer. Seeking medical advice promptly can lead to early diagnosis and a greater chance of successful treatment. Medical evaluation of persistent nausea and vomiting typically involves a combination of diagnostic tools, such as blood tests, imaging scans, and endoscopic procedures like a colonoscopy. Early detection of these symptoms and their underlying causes can significantly improve treatment outcomes. Management may involve not only addressing the tumor, but also providing supportive care, such as anti-nausea medications, nutritional support, and hydration therapy, to improve the patient's overall well-being during the treatment process. And there you have it, the critical warning signs of colon cancer you should never ignore. If you found this video helpful, don't forget to hit that like button, subscribe to our channel, share this video with your loved ones to spread awareness. It could save a life. Together, let's stay informed and healthy. See you in the next one.